Good Sunday morning, Northeast Ohio, March 19th, St. Joseph's Day, the day the Swallows return to Capistrano and the day before the start of spring, which in Northeast Ohio we know is just another day of winter with a later sunset. Day 59 of the Trump administration, and most of the talk this week dominated by the Republican proposed health care plan and the Congressional Budget Office estimate that 14 million people would be left uninsured under the plan in the first year. That's not sitting well here in Ohio. In 2013, when Ohio was debating whether to take the federal money to expand Medicaid under the Affordable Care Act, Governor John Kasich warned,
"You want to create chaos? Don't pass this and see what happens to the Cleveland Clinic and University Hospital up there in Cleveland. It will be a very bad impact on them, and I'm not about to weaken the Cleveland Clinic or University Hospital or any other hospitals around this state. That would be a big mistake for us."
Medicaid was expanded, and so the impact was not bad, but good, with the clinic in the years that followed growing by 17% from the state's second largest employer to its largest, more than 48,000 jobs. University hospitals also grew in that time span to become the state's seventh largest employer, fueled in part by a drop in uncompensated care. 40% or $70 million at the clinic in the first year alone. Hospitals are still analyzing the impact of this plan, but clinic CEO Toby Cosgrove telling CNBC, as it is written right now,
it clearly puts hospitals in a much worse position.
What the Affordable Care Act meant to Ohio was roughly 1 million people who previously didn't have insurance, most right around the poverty line, now had the ability to pay. Take it away, they're still going to seek help when they're sick. It's just now most likely to be when it reaches emergency room level, leaving the hospitals again with unpaid bills. As a result, the Ohio Hospital Association warns 1 in 4 hospitals in the state could close.
Any business would struggle under those economic conditions. And so that's why we're working very hard with policymakers to help educate them on this proposed legislation. As where it stands right now, it's just not going to be feasible for many of our hospitals in the state.
And a Metro health official telling me they have grave concerns with the plan, the way it is written right now. Metro, of course, the safety net, if you will, here in Northeast Ohio, where many poor turn for health care. Half of the patients at the county-owned facility are insured through Medicaid, and they estimate 28,000 of them benefited from the Medicaid expansion in Ohio under Obamacare. And as a result, many of them would be among that estimated 14 million nationwide who could lose coverage next year. The Washington battle comes as Metro Health begins the process towards a $1 billion transformation of the aging complex. As we mentioned, a lack of insurance often leads to people not getting preventative care and waiting until they need costly emergency care, which they then have trouble paying for.
That's the question we would have with this current proposal. How can we make sure that uncompensated care is minimized, so that we as a health system, as a business, can continue to support Medicaid and other vulnerable populations.
And Metro will be working with our local representatives in Washington to make sure those voices are heard. Well, I'm sure there are some in Washington who probably want to do with the health care plan what many of us want to do with our NCAA brackets, and that is simply rip them up and start over. Are you taking part in an office pool? If you are, you're not alone. But might the day be coming when you can bet legally on sports here in Ohio? 25 years ago, Congress banned sports betting outside of a few states, including Nevada, but gave New Jersey a window to approve it in 1993. But lawmakers chose not to, which then casino owner Donald Trump told me he couldn't understand.
Everybody wants it. We do polls showing 80%, 82% in favor. It's vital to keeping your taxes low. It's vital to the senior citizens, and it's vital to putting the bookies out of business.
Fast forward nearly a quarter century, and it is now President Trump, Solicitor General, who will help decide whether or not the U.S. Supreme Court hears a case challenging that New Jersey ruling. The American Gaming Association is optimistic they will.
Definitely hopeful that the court will hear it. The fact then that the Supreme Court has said that they do want an opinion from the Solicitor General does prove to be hopefully positive for that case and its chances.
In the meantime, a Pennsylvania lawmaker is taking a preemptive move by introducing legislation that would clear the way for sports betting in that state if the Supreme Court clears the way. Now, why that's of note to Ohio is this. When we approved gambling here in the state in 2009, we included wording in there that would essentially give our casinos the right to any type of gambling in other casinos in neighboring states like Pennsylvania. While we wait for the Supreme Court, though, the illegal bets continue, especially this week.
We estimate that about $10.4 billion will be wagered this March Madness. Of that, only 295 will be placed legally. So that means that essentially 97% this year will be done illegally.
And the American Gaming Association, which is essentially the legislative arm of the gambling industry, is hoping to know probably by June whether or not the Supreme Court will in fact hear that case. With Democracy 2017, I'm John Kosich. Enjoy your Sunday.